Today I speak with Lisiane Latouche, a perinatal and infant mental health clinician with over 30 years' experience. I have personally known Lisiane for 15 years and have had the privilege of working with her both in private practice and in other mother-baby events and workshops, our latest initiative being a Mums and Babies weekend retreat. This is an insightful and informative conversation in which Lisiane brings both her expertise but also her authentic self to explain the various challenges new mothers and families face when transitioning to parenthood. She details how we can determine the difference between things like the baby blues, maternal overwhelm, perinatal mood disorders including postnatal depression and anxiety, as well as educates on the delicate topic of postnatal psychosis, a rare but serious postnatal disorder that requires a prompt and specialised approach. You can't help but notice Lisiane's compassion and dedication to her work, and she generously shares resources and a message of reassurance to all mothers that, despite the hurdles, most mums are doing their best and that is good enough. It is comforting to know that even if there are times when, as a mother, we become emotionally or psychologically unwell, we can recover and move forward into a fulfilling and healthy life with ourselves and our families. I hope you enjoy this episode. Hello, Lisiane.
Hi, Katura.
So thrilled to have you on.
Thanks for having me.
You're very welcome. We have a very long-term relationship, don't we?
We certainly do. We've come a long way, haven't we?
Absolutely.
I recall the first time we worked together was in 2008.
Wow.
At Haberfield.
Yes.
That's a long time.
Yeah. Starting to feel my age.
Yeah.
We've kind of followed each other in different ways.
That's right.
Yeah. So I'm really looking forward to this conversation. So perhaps you could just introduce yourself to our listeners, where you're located in the world, what your background is, and also you're also a mother and a grandmother, I believe. So you can let us know about that.
Yeah. So I'm Lisiane Latouche. I've been in the perinatal and infant mental health space for over 30 years. I'm really passionate working with mums, dads, and their families in the perinatal period, which covers, I suppose, preconception, pregnancy, childbirth, and the postpartum period up to 2 years. I'm currently based at Gidget House, North Sydney, as both a clinician but also as a clinical supervisor, clinical trainer in their perinatal and infant mental health institute program, training and supporting and mentoring trainees. I'm also connected to both RPA, mother-baby unit, as a sessional clinical supervisor, and Westmead perinatal mental health team as well. I bring about more than 30 years experience working at Clinician. So I think that I bring a range of different skill set to your listeners.
Absolutely. Yeah, there's not too many people that I'm going to interview that can boast that much experience and expertise for such a long time. And also something I've always admired about you is you've sustained the enthusiasm that you had probably right from the beginning. In fact, probably it's actually grown.
I think I'm always learning. And each mother family is different, and therefore I suppose remaining passionate is very important to working in the space, because when you're working in the perinatal period, you need to bring your real authentic self in the fray.
For sure. So what are you finding, Lisiane, just sort of on a day-to-day basis when you speak to the mothers and the families? What are the things that they're most fearing or they're concerned about? What are they telling you?
I suppose over the last 3 decades, most parents, most mums and dads want to be good parents. So they have really good parental intent about doing the best they can and being the best version that they can be as parents. The families we work with and the mums we work with tend to be really worried about the practicalities of am I going to get the level of support that I want to around childbirth and the postnatal period? Is the pregnancy going to be okay? Am I just going to be coping after? Sort of, especially in the first few weeks or months following the birth of the baby. So they're really wanting to have their village around them and be worried that they may not be able to have a village around them. Yeah. Other mothers tend to worry more about their mental health. Yeah. So a lot of mums we work with may have pre-existing diagnosis of a major depressive illness or anxiety or other disorders, and they worry that they may become unwell during the pregnancy, around childbirth or the postnatal period. So some worry about whether the baby is going to be a healthy baby, whether they may experience a loss, and perinatal loss is very complex. And some of the mothers worry about adjusting as a mum within the couple relationship as well. So I would say that it is quite complex when you put it all together. They're not only worried about themselves, their own adjustment to being a mum, they're also worried about the relational context of bringing the baby home. And there's a lot of adjustment at different levels. Yeah.
Wow, that's so intriguing, so broad. Yes, it's certainly not, it's very multidimensional, isn't it?
Yeah, it's multifactorial, it's multidimensional, as you mentioned. And when you strip it back, following childbirth, a lot of mums worry about, besides the childbirth process itself, and potentially experiences of potential birth trauma. I'll just throw a little bit of data here. 1 in 3 mums are known to have experienced childbirth trauma or birth trauma. So mums are usually well informed, they're well researched, they've been on social media talking to other mums, and they're very aware that some mums experience birth trauma, so they're worried about the likelihood of birth trauma. But in the postnatal period, we're also worried about am I going to cope being a mum? Will I bond with the baby? Will I will I be sleep deprived, for example? Sleep deprivation, exhaustion is real. Because when you look at childbirth and the postnatal period, especially the 4th trimester, which is the first 3 months after birth, the impact of the perinatal period is that there's been a huge adjustment emotionally, psychologically, biologically, hormonally. So it taps all those. So the impact is actually quite huge. And so there is a period of adjustment following pregnancy, childbirth, and the early parenting days. And this is why becoming a mother has attracted a term which is called matrescence, right? I won't go into the details or the history around matrescence, but becoming a mother is associated with a very complex adjustment period affecting mums emotionally, but also psychologically and hormonally as well. So I suppose when we are looking at the perinatal period, we're looking at all the facets of adjustment. Yeah.
You know, I'm a big advocate for matresses.
Yeah.
Is that something that now comes into kind of the training that happens, say, at the Gidget Foundation, to understand all the complexities of the changes a mother herself will go through?
Yeah, I would say that if you are in the perinatal and infant mental health space, clinicians would be familiar with the term matrescence increasingly. And in fact, the term patrescence was floated around in 2023 because there's a lot of focus about being more father inclusive.
Yeah.
And there's a lot of work taking place in that space. And the term patrescence exists.
Yes, I've heard that too.
Yeah, which is amazing, which is awesome. That not only is there a focus on mums and the huge adjustment they are going through, but also there is a focus on the biological father as well.
Yes.
Yeah.
Yeah, it is amazing.
Yeah.
So parents that are having babies today have so much information, don't they? I know, you know, back in 2000 when I had my first son, I didn't have the luxury of having the internet or social media. And so I think we kind of went into mothering or parenting not really having too many expectations of what it would be like, how it would change us, whether we'd be able to bond with our baby. We didn't have all the terms. I think it can be a two-edged sword sometimes, though. Do you think that with so much information, do you find in some ways it contributes to some of the mothers' sort of more hypervigilance or sometimes obsessive behaviours about following milestone trackers or wondering if they're ticking every box and meeting every need? What would you say to that?
Yeah, there's actually quite, that's an interesting sort of comment because some of mums we work with do mention that even though the new gadgets are actually very helpful, for example, baby monitors or the trackers are helpful, it does heighten their anxieties. So it's a two-edged sword in a way, and it's very individual. I just want to highlight here, each mother, each parent experiences becoming a parent differently. So there would be different experiences, but for some, you may be right, it may heighten their anxiety. And I suppose the important thing for me is, are the mothers aware that the anxiety is becoming intrusive and impacting on their daily functioning? There is what we call a healthy anxiety response, which mobilizes us into taking care of the baby, being more alert. This is a very healthy, natural response to a new situation, the new parents, right? It's only when the anxiety becomes intrusive on daily functioning or their coping capacity or they're feeling overwhelmed emotionally or psychologically, and it results in panic attacks, for example.
Okay.
Then we are worried about the anxiety. So I'm pleased you've raised postnatal anxiety because a lot of the presentations in the perinatal mental health space are mums who are experiencing anxiety. We also have another group of mums who are experiencing depressive mood, low mood. So, and that can be very intrusive and impactful as well. And recognizing that you're not coping as well as you normally usually do, keeping the context of sleep deprivation in mind and being tired. But if it lasts, if anxiety or depression or low moods is impactful for more than 6 weeks at any one time, I mean, after 2 weeks, you start thinking about reaching out to your GP or your child and family health nurse, or one of the lines, Parental Plus, I would mention a little bit later. But certainly over a 6-week period, you would certainly want to reach out and get some psychological help. Usually through your GP.
Okay. Yeah, that lends me into asking about that. You've sort of answered it, but the 3-day blues or the blues, how can a woman kind of differentiate? Is she still experiencing the blues, or is it something a little bit more concerning?
The postnatal blues, the best way to describe it, the postnatal blues is a normal response to a huge change following childbirth. It's almost expected because childbirth is a biological, hormonal, there's a lot of implications. It's a biological process. The postnatal blues usually is transient. About 85% of mums or more experience the postnatal blues, and it usually lasts between 3 days to 6 days, sometimes a little bit longer, okay? But if the postnatal blues don't go away, we usually need to monitor because we are starting to think whether it is starting to move into postnatal depression or anxiety. So, but also one of the things to think about, because there's such a huge adjustment to the postnatal period, and sleep deprivation needs to be taken into consideration, tiredness, adjustment. Some mums have other children as well. So I think mums have to learn to be very kind to themselves and very self-compassionate, because if they are finding that the adjustment is a little bit tougher than usual, that's not uncommon. So this is the adjustment period. This is adjusting to parenting and being stressed. But there's a difference between being stressed and being distressed.
Right.
So, and this, if mums are finding that their moods remain low for a significant amount of time, for more than 2 weeks, and we mentioned 2 to 6 weeks, and we're talking about the anxiety, then they would be consistent with symptoms of postnatal depression and anxiety.
Okay.
Now, there is and that's 1 in 5 to 10 mums experience postnatal depression and anxiety. So the data is actually quite high, right? There is a small percentage of mums who also experience what we call postpartum psychosis. It is very rare, 1 to 2 in 1,000. So the data speaks for itself that it is a rare event. But when it happens, it's very impactful. Onset of postnatal psychosis is very distressing for the mother, but also very distressing for the father, and impactful on the family, because usually this is a time where mums needs to be seeking urgent medical help through their GP, who would probably escalate a referral to one of the mother-baby units, whether it's private or public, and will also involve mental health teams, the perinatal mental health teams as well. So we are privileged in a way to have those services. As you know, up until fairly recently, there were only private options, mother-baby units, and now we have public mother-baby units, which really improves the access to mums who may be experiencing more complex perinatal mood disorders, or maybe experiencing a relapse in previous or pre-existing diagnosis.
It's great that we're getting some more access to those units. It's really, really needed. So you've touched on postpartum psychosis. That's something that maybe we don't hear many people talking about. Given your expertise and skills, I would love to just hear a little bit more from you about educating us on what it is, how serious it is, how can we look for the signs, Does a woman necessarily know she's experiencing psychosis, or is it more visible to the people around her?
I think it's a very insightful question, because what you tend to find in sort of working in the more severe end of the perinatal space, usually people around them notice that this is not a characteristic behavior.
Okay.
There's something that is a bit bizarre, a little bit different. There's no reality testing, as we put it. And therefore it can be more visible to usually loved ones and people around them. Occasionally, mothers who may be experiencing early onset of psychosis may have moments of insight that they're not doing well.
Yeah.
And if that's the case, if they are able to activate support immediately and involve them in their care, can be very empowering.
Yes.
But for the biggest percentage of mums, it is a very difficult time. It can be a very scary time as well, because they don't know what's going on. They don't know what's happening to them. And on top of, I suppose, the impact of early onset of psychosis, for example, in the postnatal period, we have to keep the baby in mind as well, because this is a time when usually the newborn or the infant needs his mother. Mum may be breastfeeding, and so you can, I guess it's important to reflect about how can we mitigate some of the risk associated with postnatal psychosis. How do we nurture and maintain the mother-infant relationship if it's safe?
Yes.
And what scaffolds do we need to put in place during that time? And this is where mother-baby units play an important role. Because the staff usually multidisciplinary in nature, and that includes the active involvement of a psychiatrist, will ensure that mum's mental health is being assessed, treated, but also keeping in mind the mother-infant relationship.
Yeah. It's very respectful too.
Yeah. For those mums where suicide risk or infanticidal risk or other type of risk is involved, a comprehensive risk assessment needs to be completed, and usually the perinatal mental health team or the acute care team, the mental health team, they will be mobilized to support the mum in the community until mum is able to be admitted to a mother-baby unit.
Right. Yeah. So it's a very delicate situation. Yeah. Is if someone does have postpartum psychosis, has that been a progression from having postpartum depression, or can it hit just suddenly without having any prior sort of signs?
When you look at the literature, it points to the likelihood of psychosis tend to come within the context of pre-existing illnesses, mental health disorders, but not necessarily. We come across cases where mums experience psychosis and early onset of psychosis for the first time, with no known previous diagnosis, which makes it quite complex.
Yeah. And as you said, quite scary.
Quite very scary for the people around her, but for mum as well. Mums who may have complex history of pre-existing mental health disorders. It could be a schizoaffective disorder. It could be, or any other complex presentation, bipolar, for example, are also more at risk of developing or relapsing in the postnatal period. But those mums, if they are being treated and they're being followed up, can do really well.
Good.
Yeah. Yes.
So the success rates from treatment are quite promising.
Yeah.
Yeah.
Yeah. And I think that's an important point, Katura, because mums do recover from postnatal depression. Mums recover from postnatal psychosis and to lead really healthy lives.
Yes.
Fulfilling lives as career women, or sort of being really responsive and attuned mums to their children. But their recovery journey is very different, is very individual. So there's no one size fits all. How long does it take? Each one is different. It varies from person to person, depending on the impact of the symptoms at that time. Yeah.
Thank you very much for educating us on the subject, and obviously the intention is not to scare anybody or to for any mothers to think that this is going to be an inevitable outcome, because it's not, but it's good to also open that conversation because for some this is a reality. And we want to be aware of what we need to be looking for.
That's right. So it's important to remember that mums recover from postnatal depression, anxiety, or psychosis, and the earlier you seek help, the better. Your GP is an important person in accessing any supports and escalating and mobilizing mental health support if need be. And it's also very important to know that if you are at home, for example, you haven't quite been able to communicate with loved ones or your partner about not feeling well, feeling depressed or anxious, or feeling quite vulnerable, there are a number of 24/7 lines, or some of them may not be quite 24/7, but certainly extended hours. PENDA, which stands for Perinatal Anxiety National Depression Association. I had a bit of a blank there. Is certainly a really reliable source of support. And there is a new parent helpline called For When, as in FORWHN. That WHEN is also another new line as well. You have organizations like Clinician and Caritani who have their own parent helplines. They are able to be accessed as well. For mums who are experiencing more distressing thoughts, or they think they're deteriorating, then the Beyond Blue, it's a 24/7 line, and Lifeline. And Mental Health Line will be the more appropriate resources.
We'll make sure all of this information is available to the listeners.
May I add that you had mentioned the attachment relationship to the baby early on, and I think we focused a little bit more on the mental health of the mother. I just wanted to say that it's important to keep in mind about the baby, but also the fact that mums, even though they are depressed, they do an amazing job. And to remember that we only need to be good enough mothers. There's no such thing as perfect parenting. If we are available to the baby 30% of the time, and I put it in quotation mark, based on research, I think we're doing okay. And so the message is mums recover from postnatal depression or psychosis, and mums can be good enough as parents for kids to be able to thrive emotionally and psychologically. And have wonderful relationship with their children. So there are positive outcomes, but seeking help early is quite important as part of your mum's recovery journey.
Yeah. No, thank you for saying that, because I think as mothers we tend to have enough things to feel guilty about, so we don't want to add to that burden, and that's a very liberating percentage of 30%. So
it made me feel great when I had my third child.
I think so many mothers, when they hear that, are like, but I think I'm doing more than 30%, so I must be doing pretty well. So can you maybe expand on what that means, though? Like 30%, what are we doing 30% of the time, and what are we doing the rest of the time?
I suppose the 30-70 kind of percent kind of is maybe thrown around a little bit in attachment literature these days, and the good enough mum is thrown around as well, but it is based on scientific research and evidence. But for the brain to fire up, it only needs for the mum to be available 30% of the time for the co-regulation to happen in a way which is healthy. Obviously, when we're talking about 30%, most mums do more than 30%, but I think it provides reassurance to other mothers as well, that if there are experiences, times when they're not well, that remain available to the infant, and that the baby will continue flourishing and thriving developmentally. And I think it's reassuring for mums and dads to know that. And this is where the role of the partner or the carer of loved ones play an important role. If mums are finding they're not able to be attuned to the needs of the baby, and they may not be emotionally available, and they are able to access support from their partner or their village, but acts as a protective influence for the baby as well.
So if it's not the mother for a period of time, that's okay. It's another loving adult that can really take that role, and babies are very forgiving.
That's
right. Very resilient.
It only takes one attachment figure for a child to develop a secure relationship, right? So we're working towards a secure attachment relationship with your baby, but sometimes it takes a village to raise a child, right? So if mum is not emotionally available, or not available for medical reasons, then other people can step in to provide that nurturing sort of environment that the child needs to continue flourishing and thriving.
It's very reassuring. Most mums will at some point or another feel very overwhelmed, maybe sometimes a bit burdened, not necessarily enjoying their current season of mothering. Can you give us some tools and strategies for a mum that might be feeling that way?
One of the I suppose things that mums need to think about is that it's okay not to feel okay, and be very kind and compassionate to themselves, because the postnatal period is complex, where they may be sleep deprived, tired, and taking time to adjust to being a mum, and the various stresses associated with being a new parent. If you're finding they're not quite depressed or anxious, but they're not feeling great, and they are unsure whether they are depressed or not, there are a number of tools or websites they can access to maybe get a sense of where they are at. Some mums find it helpful to hop onto the Beyond Blue website, for example, or the COPE website. COPE website stands for Center of Perinatal Excellence. So those two websites are highly recognized website, and there's a tool called the Edinburgh Postnatal Depression Scale, which is a very simple to use 10-item measure that mums can complete online that gives them an idea of where they are at. And both websites actually help you kind of let you know where you are at. It gives you feedback straight away as to whether is it okay to keep going and do some basic measures like improving your sleep, improving your eating, taking care of yourself, having regular self-care, or making sure that there's plenty of movement, so all the lifestyle measures or exercise, or whether after trying all that things don't work, you actually need to go and talk to someone. And usually you can either reach out to your child and family health nurse, who are usually involved in visiting mums, or you may be visiting the clinic to check the baby, or you can talk to your GP as well. And you can just let your child and family health nurse know, or you can let your GP know that you've completed a tool online, and you wanted to maybe sort of revisit that. And they will be able to make an assessment as to whether you may need to be referred to a service in the perinatal space like the Gidget Foundation or Mums Matter, which is another service that is available, and some of the services are offered by telehealth as well. So there would be two others of potential referral pathways for mums who may be needing to access help for early signs of postnatal depression and anxiety, or really struggling with the adjustment to being a parent. So those tools may be helpful.
Absolutely. And for ones that might not feel ready to actually tell somebody kind of publicly about this, it's in the comfort of their own home, and they can just do a bit of a checklist and see where they sit. So that's really, really helpful. So you're at the Gidget Foundation primarily. And I know in the beginning of this conversation you were talking about some of the fears and concerns of mothers, and some of that was like right back to the preconception stage, the fears there, and even fears around birth. So you're seeing women earlier than postpartum. Is that something that you recommend then for women to come early if they have those concerns?
Evidence-based studies would suggest that the earlier mums reach out, the better it is. So whether we're dealing with preconception counselling, or we're dealing with a mum who may be going through assisted fertility period, or a mum who is pregnant and finding that it is either a complicated pregnancy or is not feeling great during the pregnancy, but emotionally, psychologically, or medically. Sometimes we work with mums who may have experienced previous losses, and that could be a miscarriage. They may have had a medical termination, and there's a lot of grief associated with any perinatal losses. Unfortunately, we also work with mum experiencing stillbirth or neonatal death. So when you experience perinatal loss and grief, it is very impactful because you're bringing that journey into becoming a mother for the second time, and it's very complex. So reaching out early is highly recommended so that you get the support that you need to be able to create the space, the emotional space, to bring your other baby.
So true. So what would be the process if somebody thought, I would like to get in touch with the Gidget Foundation? What would be the process of being able to start that?
Whether it's the Gidget Foundation or any psychological counselling within the private space, like Mums Matter, you would, the first port of call is actually contacting your GP, because they are then able to activate a GP referral using a mental health care plan and for well-being purposes. If you are in a position to pay for private counselling, then obviously the options are a bit more open, and your GP will be able to navigate the pathways for you, because they will be able to have a list of perinatal and infant mental health clinicians who are available. There's always a bit of a wait list in all the services at the moment, which speaks to the demand in that area. So it's important you reach out to the GP as soon as possible, because they would provide you that first line of support whilst waiting for support from a psychologist or a clinician.
And I guess if it was more serious, they would then get in touch with some of those crisis lines.
Absolutely, that we mentioned earlier.
Yes. Or if not, there's also those other helplines that would be useful along the way.
Absolutely. And it's important to remember that mums, when they are discharged from the maternity unit, they're usually given a pack of resources, including what we call the blue book. Sometimes some mums are lucky enough to get the digital blue book, and there are some numbers there, but your GP is an important resource as well.
So normally I ask this question to every participant of the podcast. I know you're coming from a different angle than maybe a mother would, but with what you've shared with us today, what would you say one takeaway point is that you would want to share with a mother that might be just struggling in her current season of mothering?
An important takeaway for me, and that has, I suppose over the years I had very different takeaways, but for me, as the years of progress, starting to value the importance of self-compassion and being gentle with yourself and feeling okay being vulnerable. Because if you allow yourself to be emotionally vulnerable, then you can therefore seek help. So self-compassion for me is an important place, because unless you are able to be compassionate to yourself, it's really hard to be able to seek the help that you need. So that would be for me an important takeaway. The other aspect of self-compassion is what are some of the little things you can do on a daily basis to nurture yourself and look after yourself and fill your emotional cup. And I find that mindfulness, for example, is a very accessible way to get the physical and emotional support that you need in a very accessible way, and it doesn't have to be time consuming. If you do, for example, 5 minutes of mindfulness every day, it's 5 minutes more than you used to do, but it allows you to be able to create a calm space and almost give you the permission to regulate yourself, so that you are able to remain calm and present, to be available to your baby. So there would be the 2 points for me: self-compassion and mindfulness. And if you're finding that with self-compassion and mindfulness, things are feeling really difficult for you, this is time to reach out early. So seeking help as early as you can. And wrap yourself with people who are loving and nurturing and unconditional.
That's beautiful. Self-compassion
is
a very important thing to cultivate, really. And it's something we need more than ever when we become mothers. We might not be so accustomed to showing ourselves that grace and kindness, but it's really important as a mother, because no longer are we just looking after ourselves. We're looking after somebody else as well.
That's right. And for you to be able to nurture a baby or a child, if you have more than one child, your own emotional cup needs to be full, as full as it can be.
And mindfulness, I know that there's quite a few apps, speaking of apps, but some of them are quite useful. I think there's the Calm app and Insight Timer and different things. Is there anything on the Gidget Foundation website that you're aware of?
There's no apps that I know of, but certainly the apps you've mentioned are Smiling Mind.
Okay.
Yeah, there's a few apps. There's quite a range of apps these days.
Yeah.
So it's being able to use the apps and apply it, and creating maybe some space to maybe start using it.
Yes. Yeah. Totally.
Yeah.
Well, thank you so much for meeting me today and talking about some of these harder topics that sometimes are seen as taboo, aren't they? But talking about them in such a dignified way, with kindness and compassion, regardless of what we're experiencing, we are all deserving of that. So thank you. Is there anything else you wanted to share with us before you leave?
Yeah, one of the things that a mum told me resonated with me recently, irrespective of the level of skill, the level of experience, of expertise that a clinician have, she said that it was the level of the humanity associated with the way we approach them is important. And she talked about the importance of human connection. And that made me stop and think, right, how important it is that we are aware of our own humanity when we're working with mums who may be struggling in that space, and remain respectful.
Yes.
Yeah,
that's something that's always...
And present.
Yeah, for sure.
Yeah.
You've always, in my experience, you've always approached everyone that you meet with that same kind of respect and humanity, because as a race, we're just all in this together.
That's right. Yeah. Thank you, Katura. Thank you for your kind words.
Most welcome. It's been a pleasure to talk to you.
And thanks for having me.
Yeah. Thank you.
I hope that you enjoyed this episode and that it offered something helpful to your own mothering experience. If you are a pregnant woman or know someone who is, head over to my website to receive your free copy of the postpartum checklist and contact list. And if you'd like to be better prepared for your postpartum, both practically and mentally, purchase the Peaceful Postpartum ebook, a 52-page interactive guide on what you need to know and what matters most in postpartum. And so that we can get these conversations out to more mothers, I'd be grateful if you could like, share, and review this podcast, and we'll see you next time.